Hi everyone, I am Dr. Bafna. I am an orthopedic surgeon specialized in arthroscopy and joint replacement surgeries. I have done my post-graduation from Delhi University. I have done my senior residency and training in joint replacement from AIMS Institute, New Delhi. Following which I have done specialization in arthroscopy and sports medicine from Sports Injury Center, Safdarjung Hospital and Yale University, USA. Today we are going to talk about ACL injuries. ACL injuries. What is ACL injury? ACL is one of the most important ligament present inside the knee joint. If you can see carefully, so there is a ligament in this area. This is a ACL ligament. This ligament is very important ligament because it connects your thigh bone to your leg bone. So if there is an injury in between, this thigh bone moves separately from the leg bone. And therefore patient will experience instability. That means patient will not get the confidence of the knee joint, especially when patient is running or playing, which involves pivoting or cutting activities like football or any contact sports. Therefore, whenever patient gets this injury, patient will experience such kind of symptoms. How do we diagnose this condition? For which, apart from clinical history, we do a detailed clinical examination and we order a MRI knee. MRI knee usually tells us discontinuity in ACL ligament and along with that secondary changes inside the knee joint. There might be meniscal tear associated with it. There might be other ligament like PCL or MCL ligament injuries are commonly associated with ACL injury. After detailed clinical and radiological evaluation, we come down to a conclusion or diagnosis and we treat patient with the help of keyhole surgery, that means arthroscopic ACL reconstruction. During the procedure, we use a small tiny hole inside the knee joint through which we insert the camera inside knee joint, and there is another tiny hole through which we insert the instrument. With the help of them, we do a ACL reconstruction. While doing ACL reconstruction, we take tendon grafts from the patient's own body, which is commonly we use is a hamstring tendons or sometimes we use a peroneal tendon, depend on patient's injury. This is a one-day procedure or sometimes we can do it in a daycare procedure. Very effective procedure. We can, with the specialized techniques, we can do it in less than 1 hour surgery. Patient is relatively painless throughout the procedure and after the procedure, and he can go home and walk next day. Usually we are advised to do physiotherapy for 2 to 3 weeks post surgery, and patient will be back to normal at the end of 3 to 4 weeks. He will be able to run by the end of 6 months and play football after that. For further more information, please connect to Cure India. We are happy to help. Thank you.
لو تريد العلاج في الهند لا تنسوا الإعجاب في الفيديو والاشتراك بالقناة ليصلكم كل جديد من كيور إنديا.